So good morning to all of you. Good morning, good morning. Okay, so let us start with the first MCQ. Welcome back. Good morning. I'll just wish you good morning. Yes. Good morning to all of you. And welcome back to the MCQs and image-based revision part 4. Okay, I've started a series Thursday, Friday, Saturday, Sunday, wherein I give you a mixed bag till your exams. Okay, we'll start with the first MCQ. Have a look. Answer this. I'm Dr. Pradeep Pawar, Professor of Anatomy. Good morning to all of you. Read the MCQ, understand it, and then answer. Yes. What do you say? Yes. Second dorsal web space, first dorsal web space. Okay, now let us analyze the MCQ. Let us go through it. A 50 years old male a 50 years old female with pain in the knee joint comes to physician for evaluation of weakness in the foot. Physical examination shows a swelling in the popliteal fossa. There is a marked weakness while attempting to invert the foot. Invert the foot. Which is that group of muscles which helps us to invert the foot? Answer this. Chalo, be interactive, be interactive. Keep on answering. Which is that group of muscles, or which is that compartment of the leg which helps us to invert the foot? Inversion of the foot is done by which compartment of the leg? Come on, answer this. Huh? Tibialis anterior. No. Tibialis anterior does inversion, okay, but we have still very powerful inverters. Who's that? The posterior compartment deep muscles. Posterior compartment के जो deep muscles हैं ना, which are those? Tibialis posterior, flexor hallucis longus, and the flexor digitorum longus. Not anterior compartment, it's the posterior compartment. Anterior compartment में बस एक muscle है. There's only one muscle in the anterior compartment, that's tibialis anterior, which does inversion. But we have got very powerful inverters in the posterior compartment. 3 inverters. One, tibialis posterior, flexor hallucis longus, and the flexor digitorum longus. And these muscles would pass between the medial malleolus and the tendocalcaneus, right? They pass between the medial malleolus and the tendocalcaneus. There's a retinaculum there which is attached to the medial malleolus and the tendocalcaneus. Like there was a retinaculum here in the hand. What was that? Flexor retinaculum. And what was this tunnel? What is this tunnel known as? Beneath the flexor retinaculum, that's the carpal tunnel. Similarly, there's a flexor retinaculum on the medial aspect of the lower limb, or the medial aspect of the leg, and the tunnel which is formed there is known as what? The tarsal tunnel. Tarsal tunnel, right? So that's a tarsal tunnel. Okay, and what are the structures which are passing through the tarsal tunnel? The tibialis posterior, the flexor digitorum longus, the posterior tibial artery, the tibial nerve, and the flexor hallucis longus. So this is that group of muscles. So physical examination shows a swelling in the popliteal fossa. There's a marked weakness while attempting to invert the foot. He's unable to curl the right toes. Curl the right toes meaning like this, curling of right toes. That is plantar flexion of the right toes, and that is the posterior compartment of the leg. Okay, curling the right toes is plantar flexion of the right toes, and this is done by the posterior compartment. Are you following this? So which is the nerve? Now tell me, which is the nerve? Which is the nerve involved? Which is the nerve? No, Polo, no. Which is the nerve? The tibial nerve, right? So that's the tibial nerve. Involvement is tibial nerve. Involvement of tibial nerve, right? So now what would the answer be? Yes, what would the answer be? Answer would be the sole of the foot. Sole of the foot. I'll draw this for you. Answer would be the sole of the foot. Look at this. I'll make it like this. Look, that's the foot here. That's a plantar aspect of the foot, huh? Plantar aspect, plantar. Your palmar aspect, that's a plantar aspect of the foot. Now, what is the nerve supply of the plantar aspect of the foot? Tell me, who supplies the skin on the medial aspect of the foot up to the great toe? Medial aspect of the foot up to the great toe. What's that? That's the saphenous nerve. So medial aspect of the foot up to the great toe, this is supplied by saphenous nerve. Who's going to supply the skin on the medial aspect of the great toe? Skin on the medial aspect of the great toe is supplied by the superficial peroneal nerve. Superficial peroneal nerve. Right, the medial aspect of the great toe is supplied by the superficial peroneal nerve. All the web spaces, look at this. All the web spaces, these are the web spaces, except the first. This is supplied by the superficial peroneal nerve. Right, very good. The first web space, this, where we put our slippers, yes, this is the first web space, and this is supplied by whom? The deep peroneal nerve. The first web space is supplied by the deep peroneal nerve. The lateral aspect of the foot, the lateral aspect, this one of the foot, is supplied by whom? Sural nerve. And sural is a branch of which nerve? Tibial. Sural is a branch of tibial nerve. Very good to all of you. Now tell me, the heel is supplied by whom? Heel is supplied by the tibial nerve. And 3.5 fingers on the plantar aspect. 3.5 fingers on the plantar aspect. This is supplied by whom? That's the medial plantar nerve. And 1.5 fingers are supplied by the lateral plantar nerve. Medial and lateral plantar nerve. Both medial and lateral plantar nerves are branches of tibial nerve. Both are branches of tibial nerve. So tibial nerve supplies the skin over the heel. And the branches of tibial nerve, that's the medial plantar and lateral plantar. The medial plantar supplies the skin on the medial aspect of 3.5 fingers on the plantar aspect, and the lateral plantar is going to supply the skin lateral 1/3 of the plantar aspect. Is this clear? That means the entire sole of the foot is supplied by whom? Tibial nerve. The entire sole is supplied by tibial nerve. Fine. I hope this is clear to all of you. Coming back to the MCQ. Okay, I'll clear this. Any doubts you have? Clear to all of you, no? This is very important MCQ. The first web space is supplied by whom? The deep peroneal nerve. The first web space where we put our fingers. Rest all the web spaces are supplied by superficial peroneal nerve. Okay? Fine. Coming back to the MCQ. So rest of the things are clear, right? No, the rest of the options would be clear to you. So understand the MCQ and then answer accordingly. See this now. Identify the blue pointed structure. Come on, there are plenty of things in the slide, okay? There are plenty of things in the slide. Let us analyze one of them. Yes, which is the blue pointed structure? What is that? Identify this, the blue pointed structure. Huh? What do you say? Okay. Keep on answering. I'm looking at the screen. Keep on answering. Till I get the right answer, I'll ask you. The nerve is pointed, a nerve. The nerve in blue. Identify the blue pointed structure. Yes, Nitin, you've got it. Yes, that's the genitofemoral nerve. Yes, this is the genitofemoral nerve. Look at that. The genitofemoral nerve lies on a muscle. What is that? Psoas major. The genitofemoral nerve lies on the psoas major muscle. This is exactly similar, if you can tell me, this is exactly similar to a nerve. Yes. genitofemoral nerve. ये है genitofemoral nerve, lies on the psoas major muscle. This exactly similar, a nerve lying on the muscle, genitofemoral nerve lying on the psoas major. Exactly similar, there's a nerve lying on a muscle here in the neck. If you can just guess this and tell me. There's a nerve lying on a muscle in the neck. Exactly similar to the genitofemoral nerve lying on the psoas major. Come on. Yes. Shasti, what is that? Scalenus? Scalenus, muscle, scalenus anterior. You got this. That's a scalenus anterior muscle, and the nerve is a phrenic nerve. The nerve is phrenic nerve. Phrenic nerve lies on the scalenus anterior muscle, and the phrenic nerve is in direct contact with the scalenus anterior muscle. It is covered by the prevertebral fascia. Prevertebral fascia. The spinal accessory nerve lies on the levator scapulae. Okay, that's another good reference. Very good. And all this, just have a look at this slide and tell me quickly, identify this. What is this nerve? I've pointed that for you. What is that nerve? Come on, be interactive. Answer, keep on answering. What is this nerve? Which has come from the thorax into the abdomen. It has come from the thorax into the abdomen. Yes. That's a subcostal nerve. Yes, that's the subcostal nerve. Very good. That's a subcostal nerve. What is this nerve? What is this nerve? You can see two nerves there, the upper one and the lower one. Which is the upper one? The iliohypogastric. Which is the lower one? The ilioinguinal. The subcostal, iliohypogastric, ilioinguinal nerve. Ilioinguinal. What is this nerve? Look, this is a branch of lumbar plexus. This is a branch of lumbar plexus, and this nerve comes out at the most lateral aspect of the inguinal ligament. This nerve comes at the most lateral aspect of the inguinal ligament, and this is the nerve which gets compressed against the inguinal ligament. The person complains of paresthesia, tingling and numbness on the lateral aspect of the thigh, and this is what we call as the meralgia paresthetica. Meralgia paresthetica. Okay. That's lateral femoral cutaneous nerve thigh. What is this nerve? Identify this nerve. But I'll just clear everything for you. Yeah. Look, what is this muscle? This is the iliacus. That's the psoas major. Identify this nerve, which lies between the iliacus and the psoas major. The nerve lying in the iliopsoas groove. That is what we call as. The nerve lying in the iliopsoas groove is the femoral nerve. Very good. That's a femoral nerve. On the psoas major, that's the genitofemoral nerve. And you can see here, medial to the psoas. You can see a nerve medial to the psoas. Look at this side. Look on this side. That's the obturator nerve. Obturator nerve. That means on the psoas, genitofemoral, lateral to the psoas, femoral, medial to the psoas, obturator nerve. Obturator. Clear to all of you? So these are all the branches of lumbar plexus. These are the branches of lumbar plexus, and this lumbar plexus is formed inside a muscle. In which muscle is it formed? In psoas major. Psoas major. So lumbar plexus is formed in the substance of psoas major. I'll just quickly go through the lumbar plexus for you. A small contribution from T12, L1, L2, L3, L4 and L5. What are these? What are these? These are the ventral rami of the spinal nerves. These are the ventral ramus of the spinal nerves. Okay, right at the outset, the ventral ramus of L4 divides into two. The ventral ramus of L4 divides into two. This is also ventral ramus. This is also ventral ramus. Like the normally, अगर आप देखते हो, if you normally see, the ventral ramus divides into a dorsal and a ventral division. This is what we know. Normally, a ventral ramus divides into a dorsal and a ventral division. But in this case, the ventral ramus of L4 itself divides into two ventral rami. Okay, divides into two ventral rami. This is also ventral ramus. This is also ventral ramus. L4 is therefore known as the nervus furcalis. Nervus furcalis. It's a bifurcating nerve. It bifurcates into two. It is therefore known as the nervus furcalis. Fine. a part of L4, this is the ventral ramus of L4, a part of L4 joins with L5. Look, a part of L4 joins with L5. Where are we? Where are we? What is this region? That's the lumbar region. That's the lumbar region. And from the lumbar region, if we go down, 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 where are we? Where are we? We are in the pelvis. Where we are in the pelvis? We are close to the sacrum. We are on the sacrum. So this is a trunk which is formed in the lumbar region and goes towards the sacrum. This is the lumbosacral trunk, right? This is the lumbosacral trunk, and this lumbosacral trunk is formed by what? L4, L5, and this lumbosacral trunk enters the pelvis, joins with the ventral rami of the sacral spinal nerves, and this is what is going to form the sacral plexus. Okay. So this L4, L5 joins with the ventral rami of the sacral spinal nerves, and this is what forms the sacral plexus. So that's how the sacral plexus is formed. That means the ventral ramus of L4 takes part in the formation of two plexus. Remember, this will take part in the formation of a lumbar plexus, and this would take part in the formation of sacral plexus. This is also ventral ramus, this is also ventral ramus. So the ventral ramus itself divides into two. It is therefore known as the nervus furcalis. Is this clear to all of you? So see, for example, sciatic nerve. Sciatic nerve is a branch of which plexus? Sciatic nerve is a branch of sacral plexus. This is a branch of sacral plexus, and you know what is the root value of sciatic nerve? Yes, it is L4, L5, S1, S2, S3. L4, L5, S1, S2, S3. Now, if sciatic nerve is a branch of sacral plexus, तो इसमें ये L4, L5 कहाँ से आ गया? Where does L4, L5 come from? That means L4, L5 from the lumbar region enters the pelvis, joins with S1 to S5, and this is what is going to form the sacral plexus. Perfect? Perfect to all of you. Okay. Now I start with the lumbar plexus. Lumbar plexus. Now what are the branches of lumbar plexus that we know? I'll just go through this. 1. Iliohypogastric. 2nd. Ilioinguinal nerve. 3rd is the lateral femoral cutaneous nerve thigh. 4th, femoral. 5th, genitofemoral, and 6th is the obturator nerve. Obturator. So these are the branches of lumbar plexus. Let us just go through the lumbar plexus once. Okay, that subcostal is not a branch of lumbar plexus. Subcostal is the ventral ramus of T12. Ventral ramus of T12. That's subcostal nerve. Okay, now some books mention T12, some books mention T12, some books do not mention T12. Okay, but I always tell T12 to be on the safer side. You see the options and answer accordingly. I'll start. Have a look. T12 joins with here. T12 joins with L1. Just understand this first. T12 joins with L1. Here it joins. This divides into two. The upper one further divides into an iliohypogastric and then ilioinguinal nerve. Iliohypogastric and ilioinguinal nerve. Understanding? T12 joins with L1. Here join ho gaya. It divides into two. The upper one further divides into an iliohypogastric and ilioinguinal nerve. The lower one, look at this, the lower one joins with a direct branch from L2. It joins with a direct branch from L2. And what is that? The genitofemoral nerve. Genitofemoral. Okay, so genitofemoral nerve ka root value will be L1, L2, but we take it as T12, L1, L2. Most of the books will mention this as L1 and L2 because they do not take T12 in the formation of lumbar plexus. Okay, but there is a contribution, right? So look at this. T12 joins with L1. Here it divides into two. The upper one further divides into an iliohypogastric and ilioinguinal. The lower one joins with a direct branch from L2 and forms the genitofemoral nerve. Now L2 first gives a branch to form the genitofemoral. After this, the ventral ramus of L2, the ventral ramus of L3, and the ventral ramus of L4 divides into two divisions: dorsal, 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 and I'll just make it like this for you. The ventral, ventral, and ventral divisions. Who divides? Who divides? Don't forget, the ventral ramus divides. Ventral ramus divides, right? So the ventral ramus divides into a dorsal ventral, dorsal ventral, dorsal ventral divisions. Now the dorsal division of L2 and L3. Dorsal division of L2 and L3 forms what? Dorsal division of L2 and sorry, my God, it's gone. I'm so sorry for this. I'll make that again for you. Just one moment. Once this is gone, no, it doesn't come back. Okay, anyway, don't worry. See, this is T12 once again, L1, L2, L3, L4 and L5. Okay, these are the ventral lemurs. At the outset, the ventral lemurs of L4 divides into two. A part of L4 joins with L5, that's lumbosacral trunk, enters the pelvis, joins with S1 to S5 and forms the sacral plexus. Now T12 joins with L1. Look, T12 joins with L1, divides into two. The upper one further divides into an iliohypogastric and ilioinguinal nerve. The lower one joins with a direct branch from L2, and forms the genitofemoral nerve, right? After this, L2, L3, L4 divides into a dorsal and a ventral divisions. Okay, dorsal division of L2, L3 से बनेगा lateral femoral cutaneous nerve of thigh. Dorsal division of L2, L3 forms the lateral femoral cutaneous nerve of thigh. Again, dorsal division of L2, L3 and this time L4. What's that? Femoral nerve. L2, L3, L4, that's femoral nerve. Okay, dorsal division of L2, L3 forms the lateral femoral cutaneous nerve of thigh. L2, L3, L4 forms the femoral nerve, and this is ventral, and ventral. The ventral division of L2, 3, 4 forms the obturator nerve. L2, 3, 4, that's the obturator nerve. This is clear to all of you? So I've just told you the lumbar plexus once. If there's anything not clear, you tell me. So what is the difference in femoral and obturator nerve? Only one difference. It is L2, L3, L4. It is the ventral ramus, common for both of them. The only difference is dorsal division and ventral division. The dorsal divisions of L2, 3, 4 forms femoral. The ventral division of L2, 3, 4 forms obturator nerve. Clear to all of you? Yes, come on, quick answer. So that's about the lumbar plexus, right? Now see the slide once again and come answer this first. Look, what is this nerve? I'll quickly go through this here. This is the subcostal nerve. That's the iliohypogastric, that's the ilioinguinal, that's the lateral femoral cutaneous nerve of thigh. This is the femoral nerve, that's the genitofemoral nerve, and this is the obturator nerve. And all these are branches of lumbar plexus except subcostal. This lumbar plexus is formed in the substance of which muscle? Psoas major. Okay, quickly tell me, what is this? This is the medial arcuate ligament, and what's that? That's the lateral arcuate ligament. The medial arcuate, the lateral arcuate ligament. What is this and what is this? If you can tell me. Yes, if you can answer this. What is this? What is this and what is this? This is the right crus of the diaphragm, and that's the left crus of the diaphragm. The right and the left crus of the diaphragm. Quickly tell me, the crus of the diaphragm are derived from what? Embryologically, the right and the left crus of the diaphragm are derived from. Yes, if you can answer this. The right and the left crus of the diaphragm are derived from. Yes, come on, answer. I'm asking you the embryological basis of derivative of the right and the left crus of the diaphragm. Septum transversum? No, it's not septum transversum. No. It's the dorsal mesentery of the esophagus. Dorsal mesentery of the esophagus, okay? So the dorsal mesentery of the esophagus forms the right and the left crus of the diaphragm. Okay, that's fine, that's good. Fine, see the next MCQ. Shall I answer this? हाँ अंकित, इसोफेगस के साथ फ्रेनिक किधर जाता है? हाँ? A 6 years old, 8 old years comes to physician because of 5-month history of difficulty in swallowing. During this time, he has a 10 kg weight loss. Esophagoscopy shows an exophageal mass in the lower 1/3 of esophagus. Yes. Histological examination of biopsy specimen reveals a well-differentiated adenocarcinoma. The patient is scheduled for resection of tumor. During the procedure, the surgeon damages a structure that passes through the diaphragm along with esophagus as T10. So what passes along with the esophagus? The right and the left vagus nerves. The right and the left vagus nerves passes along with the esophagus at T10. How does the right phrenic nerve go? Answer this. How does the right phrenic nerve go? Along with the right phrenic nerve goes along with. Answer this. The right phrenic nerve goes along with IVC. IVC. The right phrenic nerve goes along with the IVC, and the left phrenic nerve directly pierces the diaphragm and goes in. Okay. So right phrenic nerve along with the IVC passes to T8. The left phrenic nerve directly pierces the diaphragm and goes down into the abdomen. Along with the aorta, what passes is the azygous vein and the thoracic duct. Along with the aorta, the azygous vein and the thoracic duct passes. Okay, and the aorta passes behind which ligament? If you can answer this. Aorta passes behind the median arcuate ligament. The median arcuate ligament, that's between the right and the left crest of the diaphragm. The median arcuate ligament. What passes is the aorta, and along with the aorta, what goes is the azygous vein and the thoracic duct. Okay, very good. See the next slide. Identify this. Yes, Nitin, what do you say? Identify the structure passing through the marked foramen. The marked foramen is foramen spinosum. Very good. The marked foramen is foramen spinosum. And what is the structure which passes through the foramen spinosum? The middle meningeal vessels and the nervus spinosus. The middle meningeal vessels and the nervus spinosus passes through. This is the foramen spinosum. Foramen spinosum. Okay, I'll just point out the foramens for you. Quickly, you answer this. Start. What is this foramen? You can type it in short, fast, so then let us be interactive now. What is this foramen? I marked it with red. What is that foramen? Answer. That foramen is foramen rotentum. Foramen rotentum. Very good. And what passes through the foramen rotentum? What passes through the foramen rotentum? What passes through the foramen rotentum? Answer. Come on. That's the maxillary nerve. The maxillary nerve gets outside the skull through the foramen rotentum. Maxillary nerve. Male is foramen ovale. Maxillary nerve. And the maxillary nerve goes through the foramen rotentum, passes through a fossa named the pterygopalatine fossa. And now the maxillary nerve comes straight out below the orbit. Yes, below the orbit there's a foramen here named the infraorbital foramen. And the nerve which comes out from here is the infraorbital nerve, right? So infraorbital nerve is a continuation of what? The maxillary nerve. It's a continuation of maxillary nerve. Okay, so that's foramen rotentum. What is this foramen? Come on, answer this. What is this foramen? That's the foramen ovale. And what passes through the foramen ovale? MALE. This you know. M is the mandibular nerve, A is the accessory meningeal artery, L is the lesser petrosal nerve, and E is the emissary vein. Okay, so that's male. The pointed foramen spinosum, and what passes through this is the middle meningeal vessels and the nervus spinosus. Middle meningeal vessels and the nervus spinosus. And what's this foramen? That's the foramen lacerum. And what passes through the foramen lacerum is Yes, any guesses? Foramen lacerum is the internal carotid artery. Internal carotid artery, right? Oh, okay, very good. What is this part of the bone? This is a very hard part of the bone. What is that known as? The pitris part of the temporal bone. Pitris part. And what is this foramen here in the pitris part? What is that foramen? What is that foramen in the pitris part of temporal bone? Come on, answer. That's the internal acoustic meatus. In the pitris part of temporal bone, what lies is the middle ear and the internal ear. The middle and the internal ear. Yes, and which is this foramen? That's the internal acoustic meatus. And what passes to the internal acoustic meatus? The 7th nerve, the 8th nerve, and the labyrinthine artery. 7th nerve, 8th nerve, and labyrinthine artery. What is this foramen here? This is the jugular foramen. Jugular foramen, and the jugular foramen is divided into 3 compartments. 3 compartments. Anterior compartment, what passes? There's a sinus here like this. What is the sinus here? Inferior petrosal sinus. Through the anterior compartment passes the inferior petrosal sinus. Through the posterior compartment, you tell me, what is the sinus here? What is this sinus? That's a transverse sinus. The transverse then becomes an S-shaped sinus. What is that S known as? Sigmoid sinus. The transverse sinus then becomes a sigmoid sinus, and the sigmoid sinus leaves the skull through the posterior compartment of the jugular foramen. It gets outside the skull. It is now known as the internal jugular vein. Internal jugular vein. Okay, so jugular foramen divided into 3 compartments: anterior, middle, and posterior. Anterior compartment, what passes is inferior petrosal sinus. Middle compartment, what passes is 9th, 10th, and the 11th cranial nerves, and the posterior compartment, what passes is sigmoid sinus. Sigmoid sinus. What is this big foramen? Foramen magnum. And what is this foramen on either sides, on both the sides? That's the hypoglossal canal. Hypoglossal canal. Clear to all of you? Is this clear? What is this foramen? I did ask you this here. What is that foramen? Answer this. Come on, answer this. What is this foramen? That's the optic canal. Optic canal. And what passes to the optic canal is the optic nerve, and what comes in is the optic nerve, and what gets out through the optic canal is the ophthalmic artery. Optic nerve and ophthalmic artery. What is this here? Who's lying here? That's the pituitary gland. And what is that known as? The sella turcica. Sella turcica. Yes. And what is this slope known as? If you can answer, what is this slope? There's a slope like this going towards the foramen magnum, and this slope is known as the clivus. Clivus. And who's lying on this clivus? The brainstem. The brainstem lies on the clivus like this. The brainstem will lie on the clivus, and the medulla will get out through the foramen magnum. Okay, the medulla will get out through the foramen magnum. I hope this is clear to all of you. And if you can quickly tell me, what is this? There's something here. There's a fold of dura mater which is attached to this pitris part of temporal bone, and behind it is attached to this occipital bone here. It is attached to the occipital bone. What is this fold of dura mater like this? This is a fold of dura mater here. I say. This is what we call as the tentorium cerebelli. Tentorium cerebelli. So this becomes the tentorium cerebelli. Tentorium, it is attached to the pitris part of temporal bone, and behind it is attached to the occipital bone. Who's lying on the tentorium cerebelli? If you can tell me, who's lying on the tentorium cerebelli? It is attached to the pitris part of temporal bone, and behind it is attached to the occipital bone like this. Essay. And there's a gap here. There's a gap like this here for the brainstem to pass. Brainstem यहाँ से जाता है. So this is how the tentorium cerebelli is. Okay, so this is the tentorium cerebelli. And what is this notch known as? This is known as the tentorial notch. And what passes to this tentorial notch? That's the brainstem. The brainstem would be going down, no? So there has to be a space. and this is the space here through which the brainstem goes down. That's the tentorial notch, that's the tentorium cerebelli. Tell me who's lying on the tentorium cerebelli? The occipital lobe of the brain. On the tentorium cerebelli is the occipital lobe of the brain, and who lies below the tentorium cerebelli is the cerebellum. Below it is the cerebellum. Okay, I hope everything is clear to you. See the next MCQ. Come on, answer this. Yes. Look, after parting, yes, very good. After parting the entire night, a 25 years old male found difficulty in extending the wrist and the fingers in the next morning. Extending the wrist and the fingers. So which aspect of the arm and forearm? Posterior aspect. Which is a nerve in the posterior aspect of the forearm? Radial nerve. So radial nerve we know. He also complains of decreased sensations on the posterior aspect of arm and forearm. Yes. On examination, physician diagnosed compression of radial nerve in the spiral groove. One of the following statement is true. Tell me, radial nerve is a branch of which cord? Yes, radial nerve is a branch of which cord? Posterior cord. Radial nerve is a branch of posterior cord. Arises from C5, C6, C7 roots. Wrong. Radial nerve, what is the root value of radial nerve? All the roots it has. C5 to T1. All the roots. C5 to T1. Anterior interosseous nerve is a branch of it. What do you say? That's wrong. Anterior interosseous nerve is a branch of median nerve. It's a deep branch of median nerve. So what is the deep branch of radial nerve known as? That's the posterior interosseous nerve. The deep branch of radial nerve is the posterior interosseous nerve. Supplies the skin of the extensor compartment. What do you say? Yes, it supplies the skin of the extensor compartment. One is the posterior cutaneous nerve of arm, and the second one is the posterior cutaneous nerve of forearm. So the posterior cutaneous nerve of the arm is a branch of radial nerve in the axilla. That's a branch of radial nerve in the axilla. And the posterior cutaneous nerve forearm, and there's one more nerve, that's the lower lateral cutaneous nerve of arm. The lower lateral cutaneous nerve of the arm, this is a branch of radial nerve in the spiral groove. Clear? So posterior cutaneous nerve of arm is a branch of radial nerve in the axilla, and the posterior cutaneous nerve of forearm and the lower lateral cutaneous nerve of the arm is a branch of radial nerve in the spiral groove. The lower lateral cutaneous nerve of arm. Quickly tell me, who supplies the skin on the upper lateral aspect of the arm? The upper lateral cutaneous nerve of the arm is a branch of. Answer that. Upper lateral cutaneous nerve of the arm is a branch of. Yes, come on. Upper lateral cutaneous nerve of the arm is a branch of axillary nerve. Yes, upper lateral cutaneous nerve of the arm is a branch of axillary nerve. Very good. Okay, so the answer is D for this. I'll just brief you about the platform of Unacademy, and then we come back to the MCQs, right? We've got a plus subscription in which we have got daily live classes, the live quizzes, the structured courses, and unlimited access to the course material. An iconic subscription where you get the best of Unacademy, the lectures, and the pre-platter, the notes. A limited time offer when the prices are further slashed. Have a look at the website. We've started with a 3+1. This offer, 3-month subscription, you get 1 month free, and 12-month subscription, you get 2 months free. We've started with a 4-year subscription for the foundation students. A new technique, raise the hand. There's a small icon in the app. If you press that, you can directly talk with the educator. We're starting with 3 new batches. A Focus FMG batch from 14th of July. Yes, we're starting with Target Next 22 from 14th of July and second year batch from 14th of July. These are 3 new courses which are to be launched. An integrated clinical batch, we're starting from 14th of July, and so this is dual educator session and this is high topics. Okay, from 14th. Right. Download the Unacademy app. Fine. Chalo, answer this. The last MCQ. Come on, the last MCQ of the day. Answer. Yes, during cardiac surgery, a surgeon finds a large vein in the posterior atrioventricular groove. He identifies it as coronary sinus. All the following are tributaries of coronary sinus except, easy MCQ. Yes, very good, very good. Except the anterior cardiac veins. The anterior cardiac veins drains directly into, answer this, the anterior cardiac veins, and there are small veins which opens in the chambers of the heart. What are those known as? The venae cordae minimi. Anterior cardiac veins and the venae cordae minimi directly open into, answer this, directly opens into the right atrium. They directly open into the right atrium. Very good to all of you. Tell me, where does the great cardiac vein lie? If you can answer this. The great cardiac vein, where does it lie? The great cardiac vein lies in, yes, any guesses? The great cardiac vein lies in the anterior interventricular sulcus of the heart. Great cardiac vein, anterior interventricular sulcus of the heart. Very good. The middle cardiac vein lies in the posterior interventricular sulcus of the heart. Middle cardiac vein lies in the posterior interventricular sulcus. The small cardiac vein lies in the anterior atrioventricular groove. Small cardiac vein lies in the anterior atrioventricular groove. And the last one is the coronary sinus. Where does the coronary sinus lie? It lies in the posterior atrioventricular groove. Coronary sinus lies in the posterior atrioventricular groove. In some other lecture, I'll explain you the grooves and the sulci of the heart. Okay. So middle cardiac vein in the posterior interventricular groove. Small cardiac vein in the anterior interventricular groove. The great cardiac vein lies in the anterior interventricular groove. Okay. Small cardiac vein lies in the anterior atrioventricular groove. Great cardiac vein lies in the anterior interventricular groove, and the coronary sinus lies in the posterior atrioventricular groove. Tell me, the coronary sinus opens into the right atrium, right? Coronary sinus opens into the right atrium, and the opening of coronary sinus is guarded by a valve. If you can tell me the name of this valve, come on. The opening of coronary sinus is guarded by a valve. What's that valve? Answer. It's the Thibetian valve. Thibetian valve, and the opening of IVC is guarded by a valve. Opening of IVC is guarded by Eustachian valve, right? Opening of IVC is Eustachian valve, and opening of coronary sinus is the Thibetian valve. If you can quickly tell me, this Eustachian valve, this Thibetian valve are derived from what? I don't want the details, just they're derived from which part? The Eustachian valve, the Thibetian valve are derived from. The Eustachian valve, the Thibetian valve are derived from what? It's the right venous valve. It's the absorbed right horn of sinus venosus. Okay, absorbed, left nahi, right. It's the right venous valve. The right horn of sinus venosus gets absorbed. It has got a right venous valve and a left venous valve. The right venous valve forms three things: the crista terminalis, the Eustachian valve, and the Thibetian valve. It is derived from the right venous valve. The left venous valve goes and just fuses with interatrial septum. The left venous valve fuses with the interatrial septum. The right venous valve gets stretched and forms three things: the crista terminalis, the Eustachian valve, and the Thibetian valve. Okay, and both this right and left venous valve belongs to the septum spurium, and this septum spurium is nothing but the absorbed right horn of sinus venosus. Absorbed right horn of sinus venosus, right? The right horn of sinus venosus, the left horn of sinus venosus forms the coronary sinus. The right horn of sinus venosus is absorbed into the atrium, and that is known as septum spurium. इसके दो valves होते हैं, a right venous valve, left venous valve. The left venous valve fuses with the interatrial septum. The right venous valve forms three things: the crista terminalis, the eustachian valve, and the thebation valve. I hope everything is clear to you. I hope you've understood everything, enjoyed the lecture. Okay. So next Thursday, Friday, Saturday, Sunday, once again I'll continue with this MCQs and image based revision. What are topics I can explain in between, I try to explain, okay, so that you get an overall idea about the topic. Thank you to all of you. Thank you. Okay, once again, next Thursday, Friday, Saturday, Sunday in the next week. Okay, thank you. I'll stop here.